This is a video of an arthroscopic distal clavicle resection with labral repair performed by me, Dr. Brian Tan. The patient is in lateral decubitus position with the right shoulder up, and the camera is in the back viewing towards the front. Over here you can see there's already quite a lot of fraying of the labrum. This patient is a young 40-year-old patient who works as a mechanic. So here I have found that there is an anterior labral tear and I'm assessing if there is a need to fix it. So I have decided to proceed with the fixation. I will not be discussing labral repairs in great detail because it has already been discussed in a separate video. So I first remove the scar tissue within the tear. Next I pass the suture around the torn labrum, and then I use it as a suture shuttle to pass the final suture through. Here you see that I'm drilling a small hole at the edge of the glenoid. And finally, the knotless suture anchor is placed within the hole. I generally use knotless anchors because not only does it have the advantage of reducing surgical time, but there is also no need to tie knots, hence there is no risk of having a bulky knot causing irritation to the joint. I next bring the camera to the front, and here I'm looking at the back of the labrum. There is also a significant amount of fraying and tear of the posterior labrum. And I had decided to proceed with the repair of the posterior labrum as well. The size of this tear required 2 stitches and 2 suture anchors. Here you see the first suture anchor being placed. Here's the second suture being passed. And finally the second suture anchor as well. And here we have the completed posterior labral repair. I next move on to the arthroscopy of the acromioclavicular joint, which was the main pain generator in this patient. So this is a direct acromioclavicular joint arthroscopy technique. As you can see, when the scope is first put in, there is really very limited visibility, and it is easy to get lost if one is not familiar with arthroscopy. But once a needle is placed into the joint and subsequently a blade, a debrider can then be introduced, and all these frayed tissue and fibrous tissue can be removed, and that will then greatly improve visibility. We start to see the distal clavicle coming to view on your left side. And in this patient, the distal clavicle was really soft, and it was actually really easy to debride the distal clavicle using just a simple debrider rather than having to bring out the burr. So the aim is to remove just enough distal clavicle such that there is no more conflict with the acromion, yet leaving enough such that you do not destabilize the AC joint. And over here you see that I'm just trimming a little bit of the distal acromion. And the result is that there is significant amount of space within the AC joint. I'm satisfied now that there is sufficient resection of the distal clavicle. This same patient has gone back to work as a mechanic and is happy with the pain relief.